Hello everyone, welcome to Homeopathy TSKM. Today we are going to discuss about general guidelines to case taking. According to Dr. Stuart Close, the purpose of homeopathic examination is to bring out the symptom of the patient in such a way as to permit their comparison with the symptoms of the materia medica for the purpose of selecting the similar or homeopathic remedy. The purpose of case taking. There are three main purposes of case taking. The first one is to framing the totality of symptom. Individualization from the totality of symptom to bring out the symptom in the patient for the purpose of selecting the similar homeopathic remedy that is close to the patient's totality of symptom, to perceive the true picture, mode of development of the disease, chronological sequence with observed changes, and the third one for proper diagnosis. It can be nosological diagnosis, etiological diagnosis, miasmatic diagnosis, personality diagnosis, or therapeutic diagnosis. Nosological diagnosis able to separate the symptoms of the patient from the symptom of the disease. Miasmatic diagnosis is the fundamental cause of disease condition, especially chronic and polymorphic manifestation. Therapeutic diagnosis are individualization from the totality of symptom. Etiological diagnosis is cause removed, effect go off by itself. Case taking helps to prescribe an etiology, exciting, maintaining the cause of the disease. Personality diagnoses are peculiar, constitution, temperament, and mental behavior, attitude. Case-taking steps. The first is to take the patient's preliminary data, chief complaint, associated complaint, patient as person, and lastly, physical exam. Preliminary data. The physician should know the name, registration number with date, age, sex, education, occupation, marital status, religion, caste, father, mother age and occupation, siblings age and occupation, children age and occupation, address with telephone number, annual income and physician in charge. Chief complaints. Normally, we will write down the chief complaints under the location, sensation, modalities, and concomitant tables, or we call it as LSMC table. Under location, we will consider the area, direction, spread, tissue, organ, and system that is affected by the patient. Under that, we will consider the ODPFI, which is onset, duration, progress, frequency, and intensity. The onset is how the disease appears, duration, how long, progress, and how fast the disease progress, frequency, and how frequent the patient experiences the symptom, and the intensity of the symptom. The second is sensation and pathology. Sensation is whatever sensation that experienced by the patient will be written down here, which is directly linked to the location. Modalities, we will consider the causes, which is ailment from, aggravation and amelioration of the symptom. Concomitants are anything that comes along with the chief complaint without direct relation to the symptoms that experienced by the patient. Associated complaints. Still the same, location, sensation, modalities, and concomitants will be considered here, but associated complaint is any complaints that come along with the chief complaint. Patient as person. In homeopathy, we do believe in individualization, so we should consider patient as person by taking in count of their appearance, skin, hair and nails, perspiration, digestion, reaction to physical factors such as heat, warmth, cold, and so on, elimination, menstrual function, sexual function, patient or mother's obstetric history, development landmark and problems, diet and daily routine, life space, sleep and dreams. Physical examination. It is important to do general examination and systemic examination. The main purpose of doing a general examination is to confirm the overall state of health of the patient, to diagnose medical problem or clinical diagnosis, to help focus on the type of investigation needed for further diagnosis, to formulate treatment plan and also drug therapy. Under general examination, you should examine the temperature of the patient, pulse, BP, respiration rate, weight, pallor, and also check for lymphadenopathy. Under systemic examination, we should check for sign and symptom of the respiratory system, cardiovascular system, GIT, central nervous system, and MSS. Under all this system, we should do inspection, palpation, percussion, and auscultation respectively so that we can understand the sign and symptom and also indication shown from each system. It is important for us to understand the general examination and also the reading from the examination so that we can understand the differential diagnosis and go for provisional diagnosis for the patient. After that, we should do repertorial totality with approach according to either Kant, Bonninghausen, or Bogus approach. After that, after the repertorial totality, we will go for remedy differentiation, susceptibility of the patient, and then accordingly we will choose final remedy with posology, then general management, which should be advised by the physician so that the patient can follow accordingly. It can be in diet and auxiliary measure taken to help in assisting the patient's daily routine. After that, follow-up of the record should be taken. Thank you. Please do subscribe our channel for more homeopathy related videos.